Alright, when you get a cat out of the bag, if it comes skinned already, it will look something like this. As you can see, the connective tissue is this kind of cloudy / transparent film over the muscle, which hides the actual muscle fibers themselves. We don't want that. We want to be able to see the muscle fibers so that you can see the orientation of how the fibers are running in relation to the other muscle fibers. It's only by that technique that you're going to learn to distinguish which muscle is which. So, this is the beginning point. If you look over here at this other cat, this is your ending point where you can actually see the muscle fiber. For example, here's one layer, and you see stuff underneath it as well. Okay. So, how do you get from this point to this point? Well, with the instruments. You can use hemostat or you can use pickup. Probably at this point, I don't know how long I'm going to be hanging on to the connective tissue, so I prefer to use the tweezers, the pickups. Okay, take your pick. Remember, whichever you want to grasp better or not, that's fine. But you definitely want to use the pickups, and you can kind of pick away at it a little bit. You can use the probe to help you along in terms of removing the connective tissue. Okay, now you only want to remove the fat and the connective tissue. Do not go deep. Okay, if you go deep, you're gonna run into muscle fibers. Now, how can you tell if it's connective tissue? Well, see how easily this removes? I just pretty much pull on it, do a little bit of slicing here, just moving across, and it comes off easily. That's connective tissue. Okay, this is fascia, another word. If you learn that word in the lecture hall, it should be called fascia. And part of this is also adipose tissue. Okay, I see some fat in here as well. And as you go along, you're going to take the excess and make yourself a little pile so that it's easy to clean up later. So we will continue this and just kind of tug along at this layer to expose the stuff underneath. Okay, at this point we have a nerve. I know because it's very hard and it's white. It's tough to cut. So it's a nerve. And if the nerve does not want to be removed, well, then you have to resort to your scissor. If you look at this membrane that I have just lifted off of this cat, you see tiny little muscle fibers running through it. Very, very fine fibers running through this. This is part of a superficial muscle called the greater cutaneous muscle on the cat. So sometimes when we take the pelt off, this superficial muscle will stay on the pelt. Otherwise, it may remain on the torso of the cat, but go ahead and remove it because you want to know the muscle underneath, deep muscle.